Hi guys, this is Dr. Cheryl Schmidt from Vital Chiropractic, and today I have Christina Chamberlain with me today from East Side Total Health and Lactation down south of us. I'm going to read you a little bit about Christina so you know where she's coming from, and then we're just going to get chatting about taking care of moms in the prenatal and postnatal period, working with other providers to help the whole person to get healthy and have them have a great community and support system. And then we are going to actually talk about some breastfeeding difficulties and some things that people can do, because Christina is doing a lot of that lately, working with moms with breastfeeding difficulties of all kinds. So here is Christina. She is a certified nurse midwife, international board certified lactation consultant, and co-owner of Eastside Total Health and Lactation. Since graduating from the midwifery program at University of Washington, she has worked in community health centers, hospital-based midwifery practices, and in private practice. Over the last few years, Christina has focused her practice on providing care for women who are struggling with breastfeeding for a variety of reasons. Through her work with her patients in the Seattle area and the clinical work she has done internationally, she knows that all women want the same thing in healthcare: to be listened to and to be respected. Thank you, Christina, for joining us. I look forward to sharing all your information with people, because I know you've been doing this for a while and have all kinds of tons of wonderful information for moms. So did you want to add anything to that, what you've been up to? Anything?
No, I'm ready just to chat.
Okay, cool. So you work down in is Issaquah East Side? Where exactly is your?
We're actually in Kirkland.
Okay, so you're in Kirkland. So you guys have yourself and Jennifer, who couldn't come with us today, because as it goes when we work with moms and babies and pregnancy, that things come up and we have to sometimes take care of clients when we're not always expecting to. So so you and her work together there. What are you guys doing in the office, and who is working with you in there?
Sure. So Jen and I started our health center. We're both nurse midwives, but we actually don't catch babies anymore. We focused our practices on kind of the before and after that part of your life period. So we do women's health, all aspects of gynecology, whether that's birth control or infection check or anything, just your annual exam. We also do inseminations for people who don't have access to sperm, so single moms by choice or lesbian clients who need some help with getting pregnant. We work with them, and we also work with some infertility clients, some heterosexual couples who are having some infertility issues like cycle issues for the female partner. Then we can certainly work with that. And then I focus a lot on breastfeeding and lactation. I see moms for a variety of different issues. We also see moms after they've had their baby for pelvic floor therapy, getting all of those muscles and that part of their body kind of back in shape so that they have lifelong health. The pelvis is usually very ignored postpartum, so we like to work with them with that. And then we also have some other providers in our office. We have a massage therapist who does craniosacral therapy from birth to all ages. We have an acupuncturist who works with all different health issues, but also focuses on our fertility clients. And she works with people prenatally who are either having some prenatal symptoms like nausea or to help them get ripe and ready for labor. And then we have an energy worker who does a mothering kind of talk, energy healing with getting people as they adjust into motherhood and that sort of thing. So we really, our goal is to be a one-stop shop for families' healthcare needs. And so we try to have what kind of provider our clients are always looking for.
Yeah, it sounds amazing. You guys have a system set up to see the whole person. You have multiple practitioners who are looking at whole health. And I know that you have, there's also a chiropractor who works in the same building that you guys work with and refer out to other chiropractors as well. So you have that as part of it, which I think is amazing that you are using that as a tool in prenatal care as well as postnatal care. What do you think is the greatest benefit for having that holistic view of working with a person and caring for that whole person?
Well, I definitely think that, we've had clients who come in and they've seen all of us for our different specialties or modalities. And one thing that we hear a lot from them is they love coming here because everybody already knows their history, already knows what they're going through. And we just kind of come at them with our different specialty, but they don't have to constantly repeat their story or get familiar with another office or a new provider. So it really does feel like they're in a very comfortable, safe place. And that's definitely our goal, is we want people to feel really comfortable. And we have people who bring their babies and their toddlers and their partners. And we want people to feel comfortable so that we can get to really know them. And I think that makes us better providers in knowing their whole life, not just, oh, you have this breast issue, we're only going to deal with the breast issue. We're kind of looking at who they are and what's going on in their life in other aspects as well.
Yeah, and that makes complete sense, because you can't really take parts away,
right,
and not get to the source of the problem. Like in chiropractic, we always talk about getting to the source, and there's thoughts, traumas, and toxins that are always creating disharmony or dis-ease in the body. So if you're just looking at one part, you're probably missing the whole picture. Yeah. And you can be really leaving out a lot of things that can help the mother.
Sure.
And so you guys are using more natural methods, it sounds like, because you're using massage therapy, you're using acupuncture, using these herbs and things like that in the practice, or lean more towards natural.
So, I think that's one of the great things, because we are nurse midwives, we have full prescriptive authority, but we don't have to use it if there's a better way. We definitely try to incorporate other modalities where we have the less exposure or less invasive procedures, so that kind of thing. We'll certainly try those things first, but obviously if somebody truly needs a medication, then we are able to provide that as well.
Yeah, and that's a great philosophy to have. We always like least invasive to most invasive. Let's start with the least invasive things, or the things that are more congruent and harmonious with the body first, and then try to get things taken care of in that way first, and then help them out. So you guys have a great success rate with helping people with fertility issues.
We do. We've actually been really surprised with how many people who are looking just to get their cycles back on track have come to us. One of the things that we have found is certainly weight, and having extra weight and diet can, as you know, affect your fertility a lot. So we've been seeing more clients who kind of want to fix that aspect of their life, or that's what we're encouraging. So we're actually looking into starting kind of a weight loss program specifically to work around those issues. Another provider that we refer to a lot, we work very closely with a local nutritionist. She sees a lot of our clients. She has also created a prebiotic product that we offer to our clients as well. So we work really closely with her. She's one of our extended kind of referral providers that we work a lot with.
Awesome. Yeah, we do that a lot within our profession too. There's a few chiropractors who specialize in fertility, and diet is huge, and nutrition is huge. And the toxins that women have in their body, just in the environment that you can't avoid, but then also through medications and long-term use of birth control, can really kind of mess up your cycle. But you can do a lot of things naturally through diet and herbs and homeopathic remedies.
And certainly, like, a lot of us do have some extra weight, and that can throw off our cycles. So that's how it affects our fertility. If that extra weight is because we eat a lot of high sugar foods, sugar and our insulin, all of that definitely is affecting our cycles and fertility. We see that a ton. We see if people clean up their diet, they're able to lose some of that extra weight, then suddenly they have these regular cycles, and it all is working the way it should again.
Yeah. Do you see any specific issues with certain foods causing more damage than not, or other foods? Like, I know as we say gluten, sometimes people have gluten sensitivity, and that can really cause trouble.
Yeah, I find, I'll say with babies, whenever we're having some concerns about babies, I usually think dairy is the first culprit with the babies. So we talk a lot about what mom's diet looks like as far as dairy goes. And if she's already eliminated dairy, then we kind of go through the usual suspects.
Yeah. Yeah, I know babies, constipation, breastfeeding, colicky kind of symptoms, dairy, and gut dysbiosis in general, we see a lot of, and so we have to work on that. So we're doing a lot of the same things in our office, but I love that you guys have so many providers that you're working so closely with on more of a holistic view too with moms. And so you specialize or focus more on breastfeeding challenges. So what are some of the things that you're seeing right now that are most common, I think, in moms with breastfeeding issues?
Well, kind of the hot topic in breastfeeding medicine right now is a tongue tie or a lip tie situation and how that can affect breastfeeding. So I think we are seeing it more now, and that is probably because a lot of us are better at diagnosing it. We're more educated, so we know now what we're looking for and how to treat that. There are some theories of why it actually is just becoming more common, regardless of our ability to diagnose it. But regardless, if a baby is tongue or lip tied, that does affect breastfeeding with either they're not able to get milk from mom, so that usually looks like weight loss or a no weight gain for them. They're damaging mom's tissue on her nipples and causing some pain and discomfort there and just trauma to the tissue. And that in turn can affect her milk supply. So then you have this low milk supply issue. So even though maybe the core issue was a tongue or a lip tie, it becomes kind of this whole cycle. Yeah,
we're seeing a lot of that. And like you said, we don't really know if we're diagnosing it better or if it's showing up more often, not really too sure why it's become more common. But it also does affect, and working with the craniosacral therapist, if a baby has a tongue tie or lip tie, it affects all their cranial bones and how they function, and also the upper cervical spine, where we come in as chiropractors working on their neck and their glossopharyngeal nerve and the nerves of the tongue and the palate and the face, to help to make sure that they have proper suction patterns, or relearn those patterns depending on how long they've had the issue before. So,
and I pretty much recommend just about every baby I see with a tongue tie for body work. And I'll talk to the family, what does body work mean? For me, because I think it has kind of a lot of different modalities under that term, that blanket term. But for me, I usually talk about either craniosacral therapy or chiropractic care. And how that really can make a big difference. A lot of times, even if it's not a tongue tie, if a baby has just so much hypertension in the oral muscles, whether that's because of their positioning in utero or because of the birth experience, if their muscles are kind of stuck in this pattern, that's going to affect how they latch on. They're going to have this really narrow little latch instead of this really wide, deep latch. That is going to just start a lot of the problems that I mentioned already. Mom's going to be uncomfortable. Baby's not going to get as much milk. Her supply is going to start to tank, and baby's going to lose weight. So, I recommend a lot of baby. I wish I knew about craniosacral when I had my babies, because I think definitely my first could have used it a lot.
Yeah. And in my office, I utilize chiropractic care and cranial. I do work on cranial bones as well. A lot on babies, and even some babies who aren't even having really symptoms can have some asymmetry in the function of their cranial bones or their cervical spine specifically, but other areas of their spine as well. So
I see a lot of babies with torticollis that definitely you could treat for that.
Yeah, we see. Yeah, and I think babies respond so quickly if you get to them early on, because they don't have those years and years of patterns, asymmetry and disruption, so you can care for them and they get results and respond so quickly. It's great. And then moms get to sleep and the babies get to grow, and it's all great. So what are some other things that you see? I know everybody from birth to on should be making sure that they are aligned and that they're functioning properly. So what else are you seeing as far as breastfeeding? I know that I see challenges with moms who have to go back to work and having to pump and just trying to keep supply up. So what are some tips you have for moms that are going back to work, that maybe breastfeeding was great for the first 6 weeks, now they have to go back to work and they're having issues keeping their supply up Is there a good pump, a better pump to use? Is there some nutritional ideas?
Sure. The first and foremost thing is the whole supply and demand. So if they're away from their baby and the baby's not there to tell their body to make milk, then they're relying on the pump to do that. So a lot of times what I'll see is moms aren't pumping as much as they would have breastfed because they're busy at work and they didn't think about it, or they couldn't get away to do it, or any of that stuff. So that's usually the first thing, is really making sure that you're keeping to that schedule and you're really stimulating the breasts as often as you would. And, most babies are better than pumps, and most moms will let down better to a baby than to a pump. So if that seems to be the issue, then I would definitely recommend maybe adding another pump session in at work, if possible, setting an alarm. First and foremost, making sure everybody in your office or at your workplace knows that your plan is to pump, so they all are on the same page and they're respecting you taking that time out of the day without interruption or anything like that. And then certainly there are herbs that I would recommend that can help support mom's milk supply. I don't think any of the herbs will necessarily replace breast stimulation, so pumping and baby are definitely number one. But herbs can certainly support her hormone levels and just help her kind of maintain a more robust supply when she's away from baby. My favorite herb as of late has become Malunggay, because I hear more positive results or more positive feedback from the moms who use it. So that tends to be the first one that I usually recommend. But there are others and that can definitely help. If somebody's past a month postpartum, I probably wouldn't recommend fenugreek. Just it tends to work better closer to the birth. So by the time moms are going back to work, it probably isn't the strongest herb necessarily to use. Other things like having something that either reminds you of baby or smells like baby, kind of clicks into that hormonal and that emotional connection that you have with your baby, that can help elicit a stronger letdown. So if you have like a blanket that smells like your baby wrapped around your shoulders while you're pumping, if you're looking at pictures or video of your baby on your phone or photos around your workplace, things like that can certainly help. And if somebody truly is having trouble finding the time to pump at work, they do make a hands-free bra that can actually be a lifesaver. So you can type away while you're pumping, and that helps a lot of the moms that we work with. I think almost everybody has a hands-free bra now.
I know. Sometimes I think that's a great thing. It's great that they have that option, but it's also kind of sad that we have to have that option in our society.
100% agree.
We can't take 20 minutes or half an hour 3 times a day or whatever it is that they need to be able to
just going back to work at 6 weeks. I mean, that's like a whole nother conversation.
I know. We could get into all the politics on that and talk for hours, right? I'm from Canada, so I know in Canada they get a year off, and either mom or dad can take it. So mom could take 3 months, and dad could take 9 months if they wanted to, or mom could take the whole year. So
that's awesome.
Yeah, it's a really great program they have for supporting parents, and of course the United States difference. We know is the absolute worst, I think, of anywhere in the world for supporting.
Yeah. And we've been contacting different organizations and corporations about creating a more breastfeeding friendly environment. We have started doing, at the end of 2017, we started doing webinars at Microsoft, specifically around breastfeeding and pumping back at work. And those have really gained in popularity. So every time we do 2 webinars a quarter, and we always have more and more people interested. And we have been talking to other corporations about how we can help to create a more supportive environment. So I definitely think it's an important thing to kind of keep on the forefront. So corporations are always kind of reminded, like, this is something you need to support your employees on.
Yeah, I mean, it makes such a huge difference in the health of both baby and mom in the long term.
Certainly.
I nursed all my babies. I have 4 children, So I have 3 boys and a little baby girl, and my baby girl's 22 months now and still going strong. My boys all nursed until they were over 3 years old. So
that's perfect.
Got lots and lots and lots of mommy milk.
Nice. Good for you.
So I just wanted to see if you had any other hot topics you wanted to talk about, anything we didn't touch on, anything that I didn't ask you that you want to.
No, well, just, we definitely love to, if there are any providers out there who don't know us yet, we love to always make those connections. So please feel free to reach out. And the only other thing I would say is that I think kind of, probably not in Canada, but in here that gets kind of overlooked is the whole pelvic floor therapy. So we usually work with women after 8 weeks postpartum. But that's something certainly that we can help women kind of get those muscles back together. We can work with chiropractors. I've definitely had lots of clients who will see us before their chiropractic appointment. So we kind of loosen up all of the muscles so that the chiropractic appointment can be more effective. And that's worked really nicely. Yeah. So that's a big, another big thing for people to kind of remember that's needed.
Yeah, pelvic floor is huge. People need to have chiropractic care if they're working on pelvic floor issues. There was a study that came out not all that long ago, maybe 4 or 5 years ago, maybe a little bit longer, out of New Zealand, showing that women who are under chiropractic care, their pelvic floor muscles strengthen, increase dramatically versus people who are not under care.
Oh, I believe it. Yeah.
Yeah.
Just because my clients who are working really closely with a chiropractor, when we work together on that same client, they make tons faster progress.
Yeah. Yeah. Mm-hmm. And that's, when your nervous system is firing good, things are going to get better a lot faster. So that's what it's all about. Well, I'm glad that you guys are doing this for women because it's so needed in our community. We don't have the support and community that we once had years and years and years ago. And a lot of people are out there feeling kind of alone with their struggles, and they might have 1 or 2 people that they can ask questions to, but not always. Some people don't have anybody that can really be out there to support them. So thank you for doing what you do, and we will make sure
pleasure.
Yeah, we'll make sure that people know how to get in touch with you guys if they have questions. And Perfect. We're a little further up north, and I know there's a couple of places up here. There's a center up in Bellingham that's great for lactation support.
Yes.
So if
I probably know which one you're talking about. And if it's who I think it is, she is great.
Center for Healthy Motherhood, I believe is what the name of it is.
Becky Shays is the midwife.
Yeah, and there's also someone in there doing pelvic floor work too in that office. So there's someone up here too. If anybody's looking for somebody, just let us know. I can help connect you with people if you're down further south. Christina is a great resource to go to, and she can connect you with people too. And I know that you probably have more connections if people are outside of your reach that you can refer people to. So thanks for coming on and sharing your wisdom.
Thank you for having me.
And thank you for everything you do for moms and babies in our community and helping people live healthier and happier lives.
Thank you. Right back at you.
And thanks, guys, for joining. And if you have any questions, make sure you let us know. I'll see you, Christina.
Thank you. Bye-bye.